When individuals transition from incarceration back into society, they encounter a multifaceted network of obstacles that can significantly impact their reintegration. These challenges include unstable or inadequate housing, restricted access to healthcare services, limited employment opportunities, and untreated mental health conditions or substance use disorders. Collectively, these factors, known as social determinants of health, SDOH, in concert with legal and regulatory restrictions known as collateral consequences of conviction, CCC, play a pivotal role in determining whether a returning citizen successfully reintegrates into the community or becomes entangled in the cycle of recidivism. This reality underscores the critical importance of SDOH screening prior to release. By systematically identifying deficiencies in healthcare access, housing stability, employment readiness, and social support systems, correctional institutions and reentry programs can proactively develop targeted interventions to address these needs before an individual steps beyond the prison gates. Early identification and intervention significantly enhance the likelihood of successful reintegration, reducing the risk of homelessness, unemployment, and untreated health conditions that can contribute to reoffending. However, screening alone is insufficient. A collaborative case management approach is essential to ensure a warm handoff, a structured and coordinated transition from correctional health care and in-facility support services to community-based providers and social networks. This seamless coordination bridges the gap between incarceration and reintegration, fostering continuity of care, mitigating risk factors, and ultimately reducing recidivism. By proactively connecting returning citizens to essential services, case management improves health outcomes, facilitates stable housing, and promotes economic self-sufficiency. Moreover, these efforts enhance public safety by preventing crises before they escalate into legal or medical emergencies. The benefits of a well-structured reentry framework extend beyond the individual. For returning citizens, comprehensive case management ensures sustained access to medical and mental health care, provides pathways to stable housing, connects them with job training and employment opportunities, and fosters social stability. For the broader community, these initiatives contribute to lower rates of homelessness, crime reduction, and a decreased burden on emergency healthcare services, law enforcement agencies, and social welfare programs. By investing in structured reintegration strategies, communities can enhance public safety while fostering rehabilitation and self-sufficiency. Despite these advantages, implementing effective SDOH screening and case management programs is not without challenges. Resource constraints, including limited funding and workforce shortages, pose significant barriers to comprehensive implementation. Many communities lack the necessary infrastructure or capacity to deliver the full spectrum of support services required for successful reintegration. Additionally, public resistance to investing in justice-involved individuals can hinder policy development and program expansion. Without sustained funding, interagency collaboration, and consistent follow-up support, these programs risk becoming fragmented and ineffective, leaving returning citizens vulnerable to instability and recidivism. Ultimately, meaningful criminal justice reform requires a commitment to evidence-based reintegration strategies that address the root causes of recidivism. By prioritizing SDOH screening and collaborative case management, we can build a more effective, equitable, and sustainable approach to reentry, one that benefits both returning citizens and the communities to which they return. If you enjoyed this video, stay tuned for future videos and many more to come on my YouTube channel and on the O'Neill Perspective podcast. Politics, power, and policy.